All right, this chapter is in your anatomy book, chapter 6. It's called Mechanisms of Disease, and it starts on page 112. And this chapter is a one-chapter test that goes with your medical asepsis grade. And asepsis is, we're dealing with infectious disease and how to avoid being infected. And so that's what this chapter is all about, is the types of infections that we can contract. And so we start out with a lot of basic terminology, and yeah, you need to know all these. These are basic disease terminology. The first one is called pathology, and in med term, we can break that out, patho, logy, suffix, put it together, it becomes study of disease, okay? Then when a patient has something wrong with them, they go to the doctor and they have signs and symptoms. And a lot of people sometimes will think that those two terms mean the same thing, and they do not. A sign is something that can be seen or measured by someone other than the patient. So if I have a rash, if I have a growth, if I have a high blood pressure, if I have a broken bone, all of those can be seen or measured. Sometimes not by the naked eye. Sometimes we have to take blood and test it, or we have to take an x-ray and test it, but we can visualize it using these imaging techniques or these lab work techniques. Okay. A symptom is something that is only felt by the patient. So nausea, headache, blurred vision. So when a patient says that they have those symptoms, we take their word for it, and then we look for physical signs that can explain the symptoms that the patient is feeling. Syndrome is a collection of signs and symptoms that when we put all these things together, it becomes a diagnosis. So if I have the flu, okay, I might have signs because I might have a fever. I would have symptoms such as nausea, tired, things like that. When we put it all together, the doctor then diagnoses that as the flu. Okay. The disease progression, we have the terms acute and chronic. Acute is something that is suddenly appearing, it's new, it's not normal, so it's a short term. Typically when a disease is in an acute phase, 6 months or less, okay, but that's not like a hard and fast number. However, some things that are developing slowly and last long term, we call that to be a chronic disease. Okay, there are certain diseases obviously that cannot be cured, like congestive heart failure. We can treat it, we can manage the symptoms, but we're never going to be able to cure that and have it go away. So that would be a chronic disease. And then we have subacute, which is somewhere in the middle. Now, when somebody has a chronic disease, that's how they live every day. For, let's say, somebody who has asthma. It's a chronic disease. They have it. But that chronic disease can become an acute flare-up known as an exacerbation. Because if that patient is in the middle of an asthma attack, they don't live like that every day. That attack is an acute condition, but the asthma itself is a chronic condition. So you can have an acute and chronic going on. Okay. So etiology is like the study of disease, or study of the cause of disease, I'm sorry. Okay. Some diseases, we don't know what caused them. And when we don't know what's caused it, we use the term idiopathic. I always think of like the word idiot when I look at that. I know that's not a very nice word, but I always think of that because I almost think like the doctor can't figure it out, he must be an idiot, okay? Obviously, that's not what it means, but that's kind of the word association I use that helps me remember what this word means. So idiopathic means unknown cause. Either we haven't figured it out or maybe there is no figuring it out. Okay. Communicable is an infectious disease, and that's something we can spread from one person to another. Obviously, we're in the middle of this coronavirus situation. That's an infectious disease that we can spread from person to person. But so is the flu, measles, mumps, chicken pox, things like that. Okay, pathogenesis. In MedTerm, the suffix genesis means origin or formation. Patho is disease. So this is the origin of disease. It kind of morphs into the development of a disease, how it starts and how it progresses. Okay, we have oftentimes an incubation period. That's when the disease is latent, meaning we have no idea we have it. So think of this, our current situation of the coronavirus. You can have contracted coronavirus, and you could be in that incubation, that latent period where you don't even know you have it. You have no symptoms. You're not experiencing anything. And then it progresses. The book uses the example of a cold. And that's a good example that we can all relate to, because I'm sure we've all had a cold where, like, the very first day your nose is just a little drippy, and then maybe a sneeze or two, and you're thinking, oh no, please don't let me get sick. And then you wake up the next day and it is full blown. Don't go very far from your box of tissues. You're sneezing all day. And then you hit like the worst of it. You have like your worst day, and the next day is a little better. And all of a sudden you're like, oh, cool, I haven't blown my nose in a while. And so that goes away. And they use the term there, convalescence, which is the recovery. Okay. And then you're back to normal. And that's kind of the progression of a cold. Okay. Now, sometimes we may have a chronic disease that we can't call it a recovery because it's not going to go away. We call that a remission. And so we use that word a lot with cancer, that the patient isn't experiencing those signs and symptoms. We consider that disease to have gone into remission. If that remission continues for long enough, we call that person is cured. For example, breast cancer. When everything is looking good, it looks like we're beating that breast cancer, the tissues, maybe we've had some tissues removed and it's not growing back. All of our current tests are great. We call that in remission. It takes 5 years of remission before you consider breast cancer to be cured. Okay. Different diseases have different time frames. Okay. All right, another set of words that are very timely: endemic, epidemic, pandemic. Okay. Before I go through these, I want to hit some med term. Endo means within. Epi means upon. And pan means all or everywhere. So learning these endemic, epidemic, pandemic words, if you know your med term, it can help you. Because if you think of a shape, we're just going to use a circle. And if that disease is an endemic, it stays within the circle. It's local. And that's what we would call any disease. We'll use coronavirus to be an endemic when it's very localized, like in one city. So let's say that disease spreads to a geographical region. It could be a state. It could be just one country. And we would call it an epidemic. So epi is upon. So think of it as now the whole circle, that whole shape that I did. And then pandemic means all or everywhere. That one would be global. So if it gets bigger, like coronavirus did, we then call it a pandemic because it's everywhere. And there's very few countries that the coronavirus has not affected. I actually, at this point, I believe there are no countries it hasn't affected. Obviously, some worse than others. Okay, so that's the terms. Okay, and So the tracking of the disease is where the Centers for Disease Control here in the United States come in, the World Health Organization at a global level, and we track diseases. Okay. So pathophysiology, we already talked about pathology by putting physio in the middle. Pathophysiology becomes, instead of study of disease, it becomes the study of the progression of a disease and the physiological changes in our body. So what is the disease doing to our insides? How is it affecting our cells? How is it affecting our body's function? I'm going to talk about risk factors. There are a number of risk factors. Before we get into risk factors, this doesn't mean if you fall into these categories that you are going to get a disease. It means that you are more likely to get it than somebody who doesn't have that risk factor. Some of these risk factors are things we can control, and some are things we cannot control. The first thing that you cannot control is your genetics. You have what you have based on the DNA from your parents. You can't control that. So if you carry a gene for a specific disease, you're in that risk category. There's nothing you can do about that. Okay. The next one is age. We can't control our age. Certain diseases are riskier for young children. Certain diseases are at risk for older people. So just by being in that age category, you are in a risk group. Okay. So ear infections are a young child's disease, and you'll grow out of that age category. Dementia, older, broken hips, okay, things like that. Those are your elderly years, okay? And there's different categories in the middle. Okay, those ones we can't control. This next one you can control is our lifestyle. Some of the things that we do by choice put us at risk. Obviously, the first thing they always, complain about or use as a risk category is smoking. Okay, you control whether you smoke or not. If you smoke, you're at risk for certain things. If you're overweight, you're at risk for certain things. If you drink, if you use a tanning bed, you're at risk for skin cancer, okay? So these are all lifestyle choices that we choose to do. We can control these ones. Next one is stress. Well, at first you say you can control this, although stress is one of those things that is very difficult to learn how to control. Stress can be physical, psychological, and emotional. It can put you at risk for headaches, high blood pressure, depression, heart disease, and cancer. So the better you can handle stress, the less likely you are to contract some of those diseases. Next one is environmental factors, climate, pollution. Certain diseases are in certain places. The book uses the example here. Some parasites only are in tropical environments. Well, if you don't ever go to a tropical environment, you're never going to get those parasites. Okay. Certain things, my niece has had Lyme disease in her past. And one of the things that causes Lyme disease it's carried by ticks. We actually get into that later in this chapter. Well, she's very much a nature girl. She loves the woods. She's very much an outdoor girl, which is why she lives in the UP of Michigan, because that's the environment she loves. Well, it put her at risk for being exposed to those ticks because she went to the environment where those ticks lived, and she did contract Lyme disease. Okay, so it's one of those things where if you just don't go to those environments, you're at less risk. We'll get into some things later in the chapter about a disease that's carried by birds. Well, you're not around birds. Okay, so. And then pre-existing conditions. This is not one you can control. If you have a disease, it can put you at risk for getting a second disease. The book uses the example here is if you have, where's it at? If you have blisters from a burn, you're at risk because they can break open and an infection can get into the skin. Well, if you don't have the blisters in the first place, then the infection can't get in. So the blisters put you at risk for infection. So one disease puts you at risk for a higher disease. So next, we're going to get into the difference between viruses to bacteria to protozoa to prions to a whole bunch of other things. So one at a time. Viruses. Viruses is a parasite that gets into your cells. So when that virus gets into your body, it inserts itself into your cells, either DNA or RNA. We have different kinds of cells. And that virus will then multiply itself by putting their own genetic code into our cells. Viruses are the ones that cannot be killed by an antibiotic, okay? So it just has to run its course. So the flu, a cold, coronavirus, all of those are viruses that just have to run its course. Okay. So here's a list of the variety of viruses. This is not an all-inclusive list. AIDS, which of course is not curable. So when that virus does its thing in our cells, it's going to run its course, but it's never going to go away. Measles, mumps, the flu, those are going to run its course and then go away, and we'll have some immunity to it in the future. Coronavirus, I want to touch on that one. Coronavirus is not new. The category coronavirus has been around forever. You can see here that that's SARS. We also have a Middle Eastern respiratory syndrome called MERS. The SARS you've probably heard of. This coronavirus is not new. Okay, we're going to talk in a minute about the category caronavirus. What is new is the Corona-19, which is what the COVID is that this is the 2019 new strain of coronavirus. So what we're experiencing right now is new, but the category is not. Okay, so first let's talk about AIDS because that's next in the textbook, and then we'll get into corona. So the human immunodeficiency virus, HIV, is the first thing that a patient would get infected with. As that HIV turns to causing that patient to become sick, that's when we call it AIDS. But in the beginning, when you're asymptomatic, it's just you're HIV positive. And somebody can live as HIV positive for a very long time before they actually have AIDS-related signs and symptoms. Okay. HIV is found in bodily fluids, blood, semen, vaginal fluid of somebody who's infected. The three main ways of transmitting HIV is through sexual contact with someone who carries the virus, sharing needles with someone who carries the virus, and then being exposed through either being a fetus growing in their mama's belly or through breastfeeding. There's a lot of progress through pregnancy that allows a lot of pregnancies to go with very high success rates of the baby not being infected. Other than the three that they have there, obviously any exposure to blood in like a medical setting or, you know, a parent helping a child with a skin knee where there's blood exposure. If that blood is HIV positive, obviously anyone exposed to that blood is at risk for infection. Okay. You cannot get it through saliva. 99%. I mean, it's. I don't know that there's documented proof of that ever. It just doesn't happen. So drinking fountains, sharing a straw, those kinds of things, even kissing doesn't cause HIV to transmit. Okay, the next one, corona. Corona is actually a med term meaning crown. Okay, so corona is crown. And so if you look at a coronavirus, the SARS, the MERS, the corona, the COVID-19, under a microscope, it's actually going to have some crown projections off of this cell that you're looking at, which is where corona, this category, comes from. Okay. This is also, I mean, we mentioned SARS, but also the rhinovirus, which is the common cold. Okay. Falls into this category, just the common cold that we all get every year, a couple times. All right, the next one's called flavivirus. This one is, I'm not seeing the word vector here. It's got to be in another spot in the chapter. But I want to talk about the term vector here because this disease requires a vector. A vector is an animal that transmits the disease from another animal to the human. And so what a flavivirus does is it moves from an infected bird to a biting insect, then to the human. This virus cannot go from bird to human. It requires that biting insect in the middle. This page here talks about mosquitoes. Later in the chapter, we talk about a variety of other insects and other animals that can be vectors. Okay, so it requires it. So what kind of diseases are we talking about here? Yellow fever, West Nile, and Zika are the most common ones that you hear. Obviously, you can see dengue fever, I didn't say, but usually you don't hear that one. Yellow fever, West Nile, and Zika. Okay. The next category of diseases is called a prion. Prion is actually an abbreviation of these three words. The PRO comes from proteinaceous, I just think of protein, infectious particle. So it's a protein particle. And I have a little note over here that it requires, it's a non-living pathogen. And this, when it gets into the human body, causes disease. And the types of disease we're talking about here is mad cow, and then Creutzfeldt-Jakob. Just know mad cow. It's the only one you need to know. But that's a prion disease. And so these are rare, but the Creutzfeldt-Jakob, the only reason I kind of mention it here is that when we do coding for infectious disease, it seems like that's a favorite one that is like always in assignments and on certification tests and stuff. So you'll see that term, but you probably will never see a patient diagnosed with it. So we've probably all heard of mad cow. What we want to be really careful about is if any beef has been, any cows have been diagnosed with this mad cow, this bovine spongiform encephalopathy is the real name for it, that those cows are actually put down. All right, bacteria. Bacteria is a tiny primitive cell that does not have a nucleus. There are so many kinds of bacteria and they cause a number of diseases. And when a doctor believes that you have a bacteria of some kind, by testing it in different ways, that's how they can narrow it down and identify exactly what your bacteria is. And so the first requirement is growth requirements. Aerobic and anaerobic means oxygen or no oxygen. Some bacteria require oxygen to grow and multiply and live, and some do not. So when we test it, we're like, does it need oxygen or not? If it does, then it's this category. If it doesn't, it's this category. And so by testing that oxygen requirement, they can weed out a whole bunch of them one way or another. Okay, the next one is called staining. And you will see this in your coding. you'll read a chart note and it'll talk about this being gram positive or gram negative. And what happens here is that we take that sample from our patient and we put in some liquid, whatever it's made of, and certain chemicals will cause that to be stained purple, which is called gram positive, and some won't change the color of it at all, which is a gram negative. So we can put this chemical on our microscope slide, and if it changes color, we know it's a gram positive bacteria versus the gram negative. So again, just like the oxygen where we can weed out what it isn't or what it is or what it isn't, we can do the same thing with the gram positive and gram negative. We can weed out the kind of bacteria that it is. Then the last one is shape and size. We can look at that sample, those cells, under a microscope, and what do they look like? What are they shaped like? So the first one is bacilli. They are large, rod-shaped, and found in single or groups. The next one is the cocces, which are large and round, found either single, in pairs, in strings, or in clusters. The strings are strep, and the clusters are staph. So we've all heard of streptococcus and staphylococcus, strep throat, those kinds of things. That's what we're talking about here. Okay, and then the small bacteria, which are just like little specks, they're not in clusters or anything like that. They reproduce inside other cells, inside our cells, and so that makes them a parasite. And two examples are Rickettsia and chlamydia. Okay, and so here are some pictures of what those things look like. So we talked about how they might be rod-shaped. I think of these as like being hot dog shaped. The spheres where they're in a strip, I think of like a string of peas or something, or a green pearl necklace there. And then the small bacteria, which I said were like specks, they weren't in clusters, are these ones down here. When you look at these, it talks here about whether or not they're gram negative or gram positive. So remember, when you colored it, let's say it's shaped like this, and when you colored it, it either did or didn't turn that purple, you can weed out the ones that it isn't. So if it did turn that purple, that makes it a positive. It can't be those, it's shaped like this, and it's gram positive. These are my choices. Okay. And if you look at those, anthrax, botulism, and tetanus, okay, diseases you probably heard of. And so you can see this is salmonella. Oops, come on. Salmonella, UTIs, rheumatic fever, pneumonia, meningitis and gonorrhea, cholera, diarrhea, Lyme disease, Rocky Mountain spotted fever. Okay. Some of these you've heard of, some of them you haven't. But this is how they are going to weed out what they are or they aren't. Spores. Bacteria, only bacteria, can turn into spores. And what a spore is it's dormant. It's kind of gone to sleep, or it's hibernating for the winter. And when it is a spore inside our body, nothing's going to kill it. It's resistant to chemicals, which means medication, heat, everything. It's resistant. So you can take an antibiotic, it won't kill a spore. And what happens is that when the environment is right, those spores come back to active, and all of a sudden you're sick again. Okay. So bacteria can live for a long time. And so this is why when you're given an antibiotic, they tell you to take the whole course of antibiotics. Don't stop after a couple of days when you feel better, because you could have just gotten them to, it could have just turned to a spore rather than killed it, and it'll come right back. All right, I'm going to stop my video here, and I will do a second video for the rest of the chapter. So definitely watch video number 2.